Dr. Reka Reddy here. We're going to do a quick tutorial here on just getting to know your aligners and your Invisalign treatment. I'm going to go over all of the little things that we put in your goodie bag for you because I'm sure that you don't remember every single thing that I tell you when you're at your appointment. So the first thing here is your actual bag of aligners. So if you look at the bag, first thing we see here is it should have your name. I've blocked out the first name here. This isn't actually my aligner. Underneath it is your patient ID number. This is a unique number that is given to each patient. Your patient ID number will come in handy if you ever move or see another provider. As long as they're an Invisalign doctor, they can look you up on that patient ID and they can actually order you retainers based on the last scan that we took. Underneath here, that's my name. I'm the treating provider. And then on the bag, you'll see there's an upper, lower, and what aligner number this is out of the total number of this set of aligners. So in this instance, this patient has an upper and a lower. It's number 8 of 20. In the notes section here, this is where I communicate with you when to change to your next aligner. So in this case, the next date to switch aligners is July 14th. And when you switch aligners, I like the switch to be seamless. And what I mean by that is when this patient switches to aligner number 8, I don't want aligner number 7 to have been out of their mouth for a very long time. What I recommend doing is wear aligner number 7 all day, eat dinner, put aligner number 7 back in, and right before you go to bed, put in the new aligner number 8. What we're trying to do here is minimize the amount of time between aligners. This is going to help to decrease any kind of discomfort. Like we've said before, when your trays are out of your mouth for over a certain amount of time, your teeth are rebounding or moving in a different direction. So we want to minimize the amount of time out of your mouth, but we also want to minimize the amount of time in between aligner switches. I also like you to switch at nighttime. That way you have them in your mouth for a good 6 to 10 hours, depending on how long you're sleeping. So a lot of that movement is happening the first few hours or days that you're wearing a new aligner. So this is going to really help with that. So if we zoom in a little bit closer to your aligner, you'll notice here on one side we have the Invisalign logo and then a number. So we see the number 7. That is the first digit of your patient ID. As of the time of filming this, I think we're already up to 9. On the other side of the aligner, we see a longer number. That is the next 6 digits of your patient ID number. And you'll notice that it corresponds to the last 6 digits on your patient bag as well. Then underneath that, you'll see either an L or a U. L is for lower in this case, and next to that another number, 08. That means this is the 8th aligner. And the N means normal aligner, which is what most of your aligners should say. So if you accidentally go home with an aligner like this, see this one says L for lower 01, but then after that it says T. So you should never have an aligner that says T. T means template. You'll also notice the aligner is a lot less stiff than your aligner. So you should notice pretty quickly that you took the wrong aligner home. If this happens, give us a call and let us know, because this is not going to move your teeth. This is simply what we use to put your attachments on. There are a couple other letters that you might see. If you see an R, that means these are your retainers. An O means overcorrection, or sometimes the aligners that we use at the very end of treatment to tighten up the contacts. The next thing I want to go over is your Invisalign case. So I like that the case is blue and black and not clear. So this case will fit pretty much everything. Your munchie can go in the middle. You can put both of your aligners in here, close it, and we're good. At least every couple weeks, somebody will tell me that they accidentally threw their aligner away because they wrapped it in a paper towel at a restaurant or something like that, and then they had to go digging through the trash to get it back. You don't want to lose your aligners. 1, it's going to slow down your treatment, and 2, you have to pay to replace those missing aligners. Another thing that we'll find here in the box is a package of Invisalign's cleaning crystals.
I'm not a huge fan of this product, but you can try it out and see if you like it. You basically just open the packet, drop it in some lukewarm water, and put your aligners in for a couple minutes to remove any bacteria or debris. The last thing I want to go over here is the little pamphlet that comes in your box. So it starts with your smile is just the beginning. Most of it's pretty straightforward. There's a couple of things that I do give you a little bit different direction, so I just want to go over that. If you turn the first page, congratulations, we're really excited about starting Invisalign. And this is that QR code we were talking about a little bit earlier. You can click that QR code, snap that picture, or go to the website and download the Invisalign app. The first thing we see here is recommended aligner wear time. So on the pamphlet, it says 20 to 22 hours a day. So I work with mostly adults, and our goal here is efficiency and predictability. So my recommendation is 22 to 23 hours a day minimum. So that's the first thing that's going to be a little bit different. The next thing on here is talking about cleaning your aligners before putting them in. I know most people are not going to really have access to their toothbrush at all times, or the cleaning crystals, or whatever cleaning product you decide to use. So at a minimum, try to rinse your aligners out if you can. Just get any kind of food and bacteria off of there before putting them back into your mouth. And then this just talks about where to purchase those cleaning crystals if you decide that's what you want to use. The next thing on here is talking about cleaning your aligners each time you take them out and eat with a toothbrush and water. That's great. If you're able to brush your teeth every single time you take your aligners out, that's fabulous, but most people I know don't have that luxury. If you can't brush your teeth, at least try to rinse out your aligners and rinse your mouth out before you put them back in. That's just going to prevent food and other bacteria from sticking underneath the aligner. So the last and most important thing here is the instruction on here to remove your aligners before eating and drinking anything. I absolutely do not agree with this. I actually want you to eat with your aligners on as much as possible and drink pretty much everything with your aligners on as well. There's a couple exceptions to this. One thing you do not want to eat with your aligners on is anything containing turmeric. So we find turmeric a lot in ethnic foods like curries. It's also very popular right now in smoothies and other kind of health drinks. So this is an actual example of one of my patients who eats a lot of foods with turmeric in them. So as you can see, it really stains them that bright neon yellow. And as of now, I haven't been able to find anything that gets rid of that staining, so that I do want you to take your aligner out to eat with. So the general rule of thumb is I want you to eat with your aligners on. There are a couple exceptions like we talked about just now, turmeric. A couple other things you probably want to try to avoid: gum, it's really messy, and sticky foods like caramel and toffee, stuff like that. Anything that sticks to your teeth is going to stick those aligners and make it hard to get out. So the key point here really is we want our aligners in our mouth as much as possible. If they're not in your mouth, your teeth are moving back or possibly moving in a completely incorrect direction, which is going to really slow down or hinder treatment from moving where we want it to. So here we have a couple things that we put in your Invisalign Survival Kit. I'm just going to go over those really briefly. You've got miniature toothpaste, floss, toothbrush. That's pretty self-explanatory. We put a little chapstick in there. Your lips do get a little chapped at the beginning, a little dehydrated, so you can use that as much as you want. We have a little...
So this is a cleaning solution sample I was talking about, Retainer Bright. We put 2 tablets in there. You can try those out, see how you like them. We sell those in the office, but those are also really easy to find in any Walgreens or Target or on Amazon.
There's a little nail file in here, the pink and blue thing over here. That might seem a little bit odd, but the reason it's in there is if you feel like there's a sharp edge on your aligner, something kind of rubbing on your gums or cutting your lip or anything like that, you can actually just take this little emery board and just kind of file it down so it's not rubbing. And you don't need to use this one specifically. You can use any nail file you have at home or around the house. You probably just don't want to use something that you've used on your nails. We don't want to transfer bacteria, so that's why I gave you a special one there. If you feel like there's an edge that you're not able to get on your own, just come in and we can take care of that for you in our lab. There's some Tylenol here. As I've noted before, I want you to avoid anti-inflammatories. Anti-inflammatories do exactly that. They're decreasing inflammation. What we're trying to do when we move teeth is increase inflammation and get the osteoclast to start working so we can move teeth through bone. The most common anti-inflammatories are ibuprofen and naproxen. So the brand names you're kind of looking out for are Aleve, Naproxen, Motrin, Advil, probably a couple other things. Celebrex is another one you want to avoid.
The next thing we have here, this is a little bit of whitening gel. It should also come with a little tip that goes on there. So you can put that on. You're going to unscrew this part and put that on. You're just going to put a small bead inside your aligner. Your aligners are so tight, you really don't need too much. And I generally will only put them in on the teeth that really you want to whiten. So you don't really need to whiten your back molars. Usually the front 6 or maybe 8 teeth, depending on how big your smile is. You're just going to put a little bead right in there, put your aligner on. You don't want to put too much because it will push out everywhere. We don't want to get bleach all over our gums. Put that on, leave that in for about 20 to 30 minutes. Take it out, rinse your aligner really well, rinse your mouth really well, and then put your aligners back on. You can use that as much as you want. This little tube of whitening gel should last you a pretty long time. That's just to kind of help with the stain that gets accumulated on your attachments during treatment. The last thing we have here is your munchie. So in this case, this is an orange munchie, which is what you get the first half of your treatment. We are switching to new munchies coming up pretty soon, and those are pink and blue. So if you have the pink one, that's for the first half of your treatment, and blue is for the second half of your treatment. The last thing in your little goodie bag here is our little business card. This is our after hours number. If you're watching this number might be different. If we give you a different number in the office, use the number we gave you in the office. This is a number that we monitor only after hours, so if it's during the day and you have a question, just call the office or send us an email. We'll check that a lot faster. But if you get home and you broke an attachment or you ripped your aligner or anything, you can send a picture to this number and we'll get back to you and let you know what we want you to do. So this last thing here is the sheet that I will usually have you take a picture of. This sheet is going to show you where your attachments are. If you look at the sheet, looking directly at the sheet, the left side of the paper is the right side of your mouth, and the right side of the paper is the left side of your mouth. If you see an X, that means that you don't have that tooth, or that tooth is missing. Where the little squares are, that means you have an attachment in that area. If you look really close here, you'll see on tooth number 22 that there's 2 attachments. So that's just something to keep in mind there, that you may or may not have more than 1 attachment on each tooth. So I'll usually have you take a picture of this so that every night when you're, after you're done brushing your teeth, you can just take a quick look and check to see if all your attachments are in place. So for example, in this patient, we'll start on the right side, very back tooth is missing. So we go 1, 2, the 3rd, 4th, 5th, and 6th tooth from the back on the right side should have 1 attachment each. And then, the same thing the other way, going from the other side. This person has a wisdom tooth over here, so 1, 2, 3, 4th, 5th, 6th, and 7th tooth from the far left upper will have attachment. So you can just kind of run your finger along there and see if they're present. You might also have some attachments on the inside of your bottom front teeth, generally on these 2 canines. These are not going to show up on the sheet, but you should be able to see the cutout in your aligner. And if not, you should know that we kind of talked about it during your treatment. Here is an example of what that looks like. You can see there's a little attachment right there. A little cutout for the attachment on the inside of the aligner, there and there, so you'll kind of know if you're supposed to have those as well.
So that concludes our Getting to Know Your Aligners tutorial. Hopefully you got some useful information out of that. If you're still feeling really overwhelmed, don't worry. Just follow the 3 key takeaways. Wear your aligners, use your munchie, and check your attachments. If you're doing nothing else but these 3 things, you're still going to get a great result and be really happy.